Hi, everyone. Thank you so much for joining. I'm going to adjust the video a little bit. Hopefully, you guys can hear me. So, thank you so much for joining us today. I hope you're having a great day, and you're going to see me sipping on coffee because I took my son to football practice at 4:30 this morning, and I just need a little coffee right now. So, speaking of football and football practice, it's almost fall and it doesn't feel like it here in Arizona, but it's coming. And there are some things that happen over the summer that are skin experiences. And so, we're going to talk about those and we're going to talk about how to reverse any sun damage that we get. So today we have no demo because we have talked about these modalities before and I've demonstrated them before. However, I wanted to dedicate a little extra time for questions today. So if you have any questions you've been wanting to ask, or if anything comes up after seeing the modalities that I talk about today, or any of the data I talk about, save your questions or you can just type them in right away and we'll have an extended period for Q&A today. Okay, so um, the fall is a perfect time to repair your skin. Why? Because some things have happened over the summer and you might just feel more than the back to school blahs. You might feel like you're noticing some sun damage from the extra sun you got over the summer. That comes along with some brown spots, maybe some red blotchiness, some dehydration over the summer, which affects the skin and makes it just look kind of dull and older and not quite as healthy. Some redness from all the heat and the inflammation, maybe from having too many cocktails on your beach vacation. We might have some dull texture and some roughness. That's mostly from sun damage we'll talk about. And then, of course, with all these things come collagen loss and just natural aging. But you might be seeing the results of all of these things I've just named. And then the collagen loss that has been building up over time, all of a sudden is showing its ugly head and driving you crazy. So now is a good time to stop and assess before the holiday season comes and determine if you want to do anything for yourself to get your skin brighter and younger looking and healthier looking. So, these things we just talked about, the brown spots due to excess pigment in the skin, which the melanocytes or the color cells have released due to sun exposure. The redness, that is due to vessels and inflammation in the skin. Your dull, dry skin could be due to barrier disruption. So that's the dehydration that we talked about. That leads to what we call skin barrier disruption. The rough texture, like I said, could be due to photo damage from over the summer. And then the collagen breakdown, of course, can result in fine lines and laxity. So if you look at this diagram of the skin, and the healthy skin is on the right and the unhealthy skin, if you will, is on the left. You see a breakdown of what I just talked about. On the surface, we've got the redness, we've got the brown spots, we've got the barrier disruption. Beneath the top two layers, we have the vessels, which results in the redness, and then the collagen breakdown happens in those deeper layers underneath. If you look to the schematic on the left side, this was taken from a study published back in 2009. But that's basically when people started talking more about MMPs or matrix metalloproteases. And so basically, what was proven around that time was that sun exposure leads to this oxidative stress and inflammation, and that activates these enzymes in our skin. And so these enzymes, the MMPs, lead to collagen breakdown. So that is why the sun exposure can lead to this collagen breakdown and the extra fine lines that we see in someone who hasn't used sunscreen their whole life versus someone who's used sunscreen their whole life. So a lot of times when I'm treating someone, I'm pointing out to them that they have more wrinkles on their left side than their right side. And that is because a lot of times we get more cumulative sun damage on the left from driving over the years, especially in a sunny place here like Arizona, or if you have lived in California, um, you can see that oftentimes, like 9 times out of 10. And that is due to these matrix metalloprotease activation from the sun exposure. So, but there's more going on in the summer. So heat and sweat can absolutely break down the skin barrier, which leads to irritation. The air conditioning and low humidity environments can increase moisture loss. Your travel and your routine changes can lead to disruption in your barrier and some inflammation. And then the chlorine and salt water from the ocean or saltwater pool can also lead to water loss and some inflammation. So all of these things are happening in the summer. So then you see the results of these changes. So we can do things to reverse them. And the sooner we do, the better your skin's going to look. And you're not going to let this damage accumulate. So that's the main thing. If we do things now, and it doesn't have to be a big deal, we don't have to do dramatic things. If we do things now, we're not going to have that accumulation of all this damage. And we're going to start immediately doing things to make your skin healthier and younger looking. So we're going to divide our strategy into 3 pillars. So the first thing is going to be the barrier repair, what we call the skin barrier. So basically, think of skin as your largest organ, and its main function is to serve as a barrier to outside irritants and to provide a barrier to prevent water loss from the skin. So when we don't have a healthy barrier, we have what's called transepidermal water loss. The epidermis is top part of the skin, and so we lose water from that top part of the skin. As well, we can get dehydration from this transepidermal water loss, but we also have irritants that are coming into the skin, and they are creating um, irritation, I guess. So they can create inflammation. The allergens in the air can irritate without a healthy barrier. The healthier the barrier is, the more resistant the skin is to protect itself from irritation and inflammation. Okay, phase 2 or pillar 2 is correction of the dyspigmentation. So we can have pigment, we can have redness, and then sometimes along with that comes those texture changes, those superficial texture changes. If you remember this diagram I showed you, see if we can go back. There we go. Yes. Okay, if you remember this diagram, if you see in the top part where we have the barrier disruption, and you can see how that would lead to texture changes. And so also in the bottom though, we have collagen breakdown, which I'm going to talk about in the third pillar. So we've got this more superficial texture change that comes from a disrupted barrier. And we also have the deeper changes. So going back, here we go. Okay, so this is pillar 2. We've got brown, we've got red, we've got some texture that we want to correct. And then pillar 3, like I alluded to, the collagen changes. So now we're going to get into those deeper, really noticeable effects. Okay, so we can mix and match with these, but a lot of times we do kind of go in order, to be honest. We do kind of start with repair the barrier and then go to correction of the color and then rebuilding of the collagen. And let's talk about why that strategy is. So when we are preparing for a treatment, we know there's clinical evidence. I don't think we've cited it this time, but I can certainly cite this article in the future. There is actually data showing that when we have an intact and healthy skin barrier, we're going to heal better from our more aggressive treatments. And so that's always the first thing that we start with is barrier. And if you have ever had an aggressive treatment done, like an ultra clear treatment, Fraxel, other aggressive lasers, you notice that a lot of times we suggest you stop your Retin-A beforehand. That's part of the barrier repair because the barrier can be disrupted by Retin-A or other acid products. And then if someone comes in and they've forgotten to stop their Retin-A, I will usually take a good look at their skin barrier, and especially if the patient's been on Retin-A for a long time, if their barrier's intact, then I go ahead with the treatment. So that's where that sort of recommendation or restriction is coming from. So anyway, we want the skin to be hydrated and looking great. And sometimes that's enough for patients. Patients are like, oh my gosh, my skin just looks so much better just by having a few treatments and adjusting my moisturizers. And they feel like for them, they're done and they plan their treatments further on in advance. Number two, the second pillar, correct. So when you correct the discoloration, the studies do show that correcting the pigment changes, making the skin more uniform in color, is more impactful on the perception of youth, even more so than wrinkle reduction. So, in other words, if your skin is blotchy with redness, if we take away the blotchiness, your skin will look way younger, even younger than if we had done Botox on your glabella, on your front lines. Same thing with brown. If you've got splotchy skin with sunspots and genetic spots, wisdom spots, that's going to look older to someone than a little, 6-month-old baby whose skin is flawless and doesn't have any blotchiness, obviously doesn't have any sunspots yet or any hereditary wisdom spots. And then finally, we usually end with rebuilding of the collagen. So that's the last step, but that is also going to be very impactful because when we have new collagen, we have everything. We have improvement in everything. We have skin tightening, pore shrinking, we have increased radiance of the skin, we have increased elasticity, which is very useful. So that is a very important step in our process. Let's talk more about the barrier repair. So it consists of keeping the water in and keeping the irritants out, like I mentioned earlier. And so if you don't have an intact barrier, these are the things you might notice. You notice your skin feels dry. You notice your skin feels tight. You can see that the texture is not quite it's not quite ideal. It's a little bit rough. It's a little bit flaky. Because of the irritant factor, you might feel like you have increased sensitivity of your skin. You might be breaking out in rashes more. You might be a little bit itchy. The skin can look dull, and the lines that you do have might be more noticeable. So a lot of times, if you have some fine lines and you put an effective moisturizer on them, they automatically look better. Now, that's not getting to the root of the cause, but that is actually making your skin look better because you're improving the barrier. So here is a study we threw in here. This is a study in Chinese women. So it's following almost 200 Chinese women, and they did study with very good science what is called, like I mentioned earlier, what I explained earlier, the transepidermal water loss. And then they studied the hydration of the skin. And they also study these other things, sebum, which is oil on the skin's pH, which is related to the sebum and the hydration. And they showed that the hydration was lower in the autumn and winter than in the spring and summer. And some of this is due to the sweat on the skin and the oil production on the skin in the summer. But also, I would surmise and conclude the effects of the summer, like we talked about, the chlorine and the being off your schedule, all those things are playing a part here. So, but basically this study shows that in the fall and winter we lose some hydration. So it's nice to be proactive about that and be thinking about that. Obviously, the caveats here is that sometimes you can't extrapolate the results. So if you're not a woman and you're not living in China, then these results might not extrapolate exactly for you. And here's just a little diagram of their science that they published here showing those results. Okay, so a lot of times patients come in and they're saying to me, I just need to drink more water. But unfortunately, it's not as simple as that. We have to think about using a product that has humectants in it. So something that attracts water, such as hyaluronic acid. Using something that's actually going to um, em- be considered or classified as an emollient. What is that? It's actually filling the little gaps between the skin cells and helping that skin barrier in that way. So ceramides are a great example of that. And then in some patients who are really dry or after an aggressive laser treatment, we use occlusives such as dimethicone. You can see in a lot of really nice moisturizing products. And petrolatum is what we use a lot of times after procedures, and that's found in Aquaphor and Vaseline. So if we really want to get the best protection for the skin barrier, we use all three, but sometimes we pick and choose, and that depends on the individual and where your barrier is at. Okay, so here are some examples of things that can build up your skin barrier. So for instance, number one, this is a cleanser. But this is very gentle cleanser. However, it's still extremely effective. So my opinion is there's no need for a double cleanse with this product. This is a product from a line we recently added to the office called Pavise. And I love it because of its simplicity. I am kind of a low maintenance person. Not sure my husband would agree with that, but I'm low maintenance and I like to not use the Korean 17-step skincare products, but actually use fewer products with more active ingredients in them. So this Pavise amino acid cleanser is really effective and it's not drying. And it also has, however, got my little cheat sheet here. It has some glycolic acid in it, which exfoliates actually. So it's gentle, yet it exfoliates and helps with pigment and texture. And it also has some niacinamide, which is a B vitamin, and that in itself helps protect the skin barrier and can reduce redness. So that is a really great favorite of mine, and I use that personally every morning and night. Another favorite of mine that I, again, use personally is this product from Epiance, and it's called Intense Nourishing Cream. And this is a product that is very moisturizing. It has botanicals in it to restore the skin barrier. I love this product for rosacea patients, and I'm also a rosacea patient. And I see it just by itself work in reducing redness and flushing for rosacea patients. And I think it's because of the skin barrier repair that it does. Okay, so then we can start to reintroduce something with a little bit more active ingredients in it. For instance, this Elastin Resurface Skin Polish. So this product has the little micro beads in it, so you can feel the exfoliation in it, but it also has glycolic acid and squalene in it. So it's got the exfoliation, both physical and chemical. So the physical little balls in it, and then the chemical ingredient, glycolic acid. And then it's also got the squalene to repair the skin barrier, as well as a few botanicals in it as well. And then finally, this product called Pavise. Again, this is the skincare line that has multiple active ingredients in just one product. So this is going to have your antioxidants in it to protect your skin barrier and to protect the collagen in your skin to protect from UV damage. And so it also has SPF in it. And it also has niacinamide, the B vitamin that helps protect the barrier. and it has tranexamic acid and licorice root, which help with pigmentation. So all those things are found in this one product, and we're covering sunscreen, antioxidant, exfoliation, and brown spots. So I love this product, and I use this product every day as well. Okay. Um, so here's a before and after of one of our patients treated by my estheticians. And this is just an example of Diamond Glow treatment and the barrier repair you can get after Diamond Glow treatment. So if you haven't had a Diamond Glow, it's a great treat for yourself. It's basically some suction which pulls the pores tight, and then it cleans out the pores or suctions out impurities of the pores. Then it has what they call an infusion. So it infuses a serum back into your skin. And so this is how we can sort of rehydrate the skin, but also if we wanted to deliver some active ingredients in it. So it's an extremely customizable treatment. And the different serum choices can be used to target the different needs of the skin, including the moisturization of the skin. So you can see in this photo, just by making the skin look more hydrated, it just looks better. One thing we love doing, and we started this about a year ago, is incorporating red light into our routines. And so after a particular treatment, we incorporate red light, which is really anti-inflammatory and helps us to heal faster and to see some benefit in our skin barrier as well. And also, um, we do think it stimulates collagen, so we see some longer term benefits as well. So I am an advocate of red light. That's a question that I get often. And we have incorporated this medical grade red light into our office and are using it frequently and have really great patient feedback on it. So moving to the second pillar, we have pigmentation, brown spots, the red spots, and then of course the rough spots from the superficial damage. So talking about the brown spots, what makes up the brown spots? Well, there's genetic spots such as freckles. So I always tell patients freckles are yours to keep. You'll always have them, and they'll always have the potential to get darker, usually due to sun exposure, but it can be due to inflammation as well. But we can lighten freckles. So if someone has freckles that bother them, we can lighten them. And sometimes patients like their freckles and they don't want to lighten them, and we can usually adjust the settings for our lasers to prevent the freckle lightening. But certainly we can make them lighter. Sunspots, so we call these in medical terms lentigines. Those are spots that come up from cumulative sun damage over time. So starting when you're a kid, of course, when we're kids, there's no immediate repercussions of being in the sun, but over time, we start to see those repercussions. And so a lot of times, even if someone's pretty good about using sunscreen, staying out of the sun at the current time, they're still accumulating these sunspots because the damage has been done in earlier years, and now they're finally seeing the repercussions. Sunspots are actually pretty easy for us to remove using the modalities listed below. And then something that's a little more complex and more difficult to treat is melasma, because melasma is more of a genetic condition that has a potential to wax and wane over time. And it's worsened by UV, visible light, and heat. And most people in Arizona are exposed extensively to all three. So this is something that we have tools to treat. We can make it better, but it is something that we continue to work on over time that always has the potential to worsen over time. So the most effective and most popular things that we do in our practice for these sunspots are IPL, or intense pulse light, Fraxel treatment, and medical grade skincare. So IPL is a device that looks and acts like a laser, but we actually put a filter in it. And because of that, we can really tailor the treatment to be individualized. So, for instance, a lot of times in our office, we're using IPL for brown spots, but if someone also has red, brown, and red, we can adjust the filter and adjust the settings so we can target both conditions. So we love IPL because of that versatility, and it's also really, really effective for brown spots. The Fraxel laser is great for brown spots, and it's amazing for collagen stimulation. So if you want to do both the collagen and the brown, the Fraxel is just awesome for that. And then finally, if someone's like, oh, I'm not quite ready for a procedure, we can actually get a lot of improvement just by using medical grade skincare. And always really encourage medical grade skincare. There are some dupes out there that we can help you with, but in our office, we really, really, really value the research behind these things. So we want proof that the skincare is doing what it says it's going to. And so that's why we choose the products that we have in the office, because there are studies and evidence supporting those claims. And also we see the proof in our patients. Okay, here's an example of IPL. Patient had one treatment, and usually when I do a treatment, I'm also combining it with a little bit of liquid nitrogen. So this patient had IPL and liquid nitrogen, and you can see her tone or her background skin tone is brighter, but also those brown spots, both the larger ones and the little tiny speckled ones in the background, those are significantly better here. And so you can see we haven't addressed wrinkles, we haven't done any filler, but just by clearing up her skin, you can see how much more youthful she looks. So this is something really, really significant you can do for yourself. And a lot of patients do come in after every summer, and they come in every fall and they get this done. And they kind of feel like they're paying for the sins of their summer, so to speak. Also, with these treatments, it is ideal for most patients to get them done in the fall when there's less sun versus in the summer where there's more sun, because we do put a sun restriction on you. We ask you not to get sun before or after treatment. This is Fraxel. So you guys have probably, if you've attended any of my webinars, I'm always talking about the Fraxel because I love this treatment so much. But here you see we've got improvement of her brown spots, and we've got improvement of the loose skin underneath her eyes, and we've got improvement of the fine lines around her mouth. Now, this is a pretty great result for Fraxel. Fraxel is not going to replace a facelift, and it's not going to be quite as aggressive as an ablative treatment like CO2 laser, either traditional or fractional treatment for treatment wise, but it is very, very effective, and the downtime is very predictable. We love this treatment. And the Fraxel I recommend once a year. The IPL I tend to recommend once every 6 months. So again, you don't have to be doing these things super frequently. So say this patient came in and say she had a wedding she was going to, I might recommend a series of treatments for her. So just depending on what's going on in someone's life, if someone's coming in and they want to be kind of minimalist about their treatments, a lot of times you can do these things not super frequently, but have really, really positive results. So let's talk about redness. Redness is something that's common in Arizona as well, because heat tends to make the redness worse, especially if someone's genetically prone to what we call rosacea, which is a low tendency to become red and blush and flesh. UV exposure, so sun exposure, can make the redness worse, independent of the heat. And then sometimes we have a genetic predisposition to form blood vessels, especially if someone's of Caucasian descent. That is really, really prominent in Caucasians, especially around the nose, to have blood vessels. And those only worsen over time. So they start showing up, and then we collect more, we collect more, we collect more. So the sooner you start your anti-redness journey, the better. And we do tend to treat red different than brown. So I'm going to recommend different laser for red, but the overlap is that we do recommend the IPL for both brown and red. So if you do have brown and red, we can sometimes start with the IPL, or we can alternate the IPL and the V-beam. But the V-beam is really the mainstay of anti-redness treatment. So a lot of patients who have rosacea, a lot of patients who have genetic redness, even if we're just treating around their nose, we're treating with the V-beam. So there are lots of different ways that people become red, but the end result, the redness, is what we treat with the V-beam and sometimes the IPL. With the V-beam, a lot of times that is a series of treatments. So this is something you do a series of treatments, usually 1 month apart. And it might be 3 treatments, it might be 6 treatments. But once you get to the point where the redness is controlled and you're happy with the redness, we try to go to maintenance. You don't have to do maintenance, but you choose to, you get better and better results over time. And maintenance is usually twice a year. So just like the IPL, I recommend twice a year. I do recommend the V-beam twice a year if someone is interested in maintenance. Here's someone of Asian descent who had brown spots and red spots that bothered her. And she also has some freckling. So the freckles, like I said, they don't go away, but we can lighten them. So we've got only in this photo, only one photo treatment of V-beam and one treatment of IPL, but you can see the significantly improved evenness of her skin tone. So the color is way more even in the second photo. And by the way, she has continued to do either IPL or V-beam every 3 to 6 months since this photo, and her skin is just glowing now. She receives compliments on her skin all the time, whereas when she first started, she was very self-conscious of her skin. So this can be something that's dramatically that can really it can really be life altering. It can really increase your confidence and you can go for someone who you don't consider yourself to have good skin to someone who has great skin and gets compliments constantly. Here's another patient. The lighting is slightly off here. I apologize about that. But even with the lighting be a little different, you can tell in 2 treatments, she has a significant decrease in the redness. And again, in general, the more of these V-beam treatments you do, the better the skin becomes. By the way, the V-beam also we use for little blemishes. So it can treat acne and make the acne spots go away faster and make the redness from the acne go away faster. So sometimes I'll have a consult for a laser consult, and the complaint that is in the scheduling notes will be acne. But really, when I see the patient, a lot of times it's just the redness left over from the acne. And so the V-beam is really, really useful to take care of this and also to help with, sometimes it's not actually the acne spots, but it's the redness from the acne that is most bothersome. So it can take care of that. Okay, final column would be the texture of the skin. So the mainstay of the texture of the skin is going to be collagen formation, and bonus if we can get some increased cell turnover with that. So texture, remember that diagram I showed you? It goes all the way from the bottom up to the top. All of those layers can affect the texture of the skin. The most impactful is going to be the deepest, where the collagen is. But even as we go up with the skin barrier, we can get some texture improvement. So by decreasing the dehydration, we get texture improvement. By reversing the photo damage with the collagen repair, we have texture improvement. By increasing cell turnover with exfoliation, we have increased texture improvement. So the right treatment is going to depend on you and what your skin looks like during our physical exam and how far you want to go with this. Like what is your budget for this? How many office visits do you want to come in for this? Do you prefer to avoid downtime or do you not mind some downtime? So all these things we can discuss with you before you decide on a treatment regimen. But here are the most common ways that we treat texture in our office. So chemical peels are probably the easiest way to treat texture, and they produce an immediate glow. So there can be no downtime with chemical peels. We can tailor it for individuals. So sometimes we do a little bit of a more aggressive chemical peel, but we can do a peel that does not actually physically peel. It's exfoliating microscopically, but we don't have to have downtime. And those are the ones where you can come in before a party and leave and you're just glowing. And you can also combine this with a diamond glow treatment where you're hydrating and you're doing a little bit of a stronger treatment with the chemical peel, but you're also getting that immediate glow with the Diamond Glow. So it's great, like it says, for texture, great for dullness of the skin, and it can help with pigment. If you go to the left, the microneedling with the PRP is amazing for texture, and it's a very, very easy treatment to do as a patient because the downtime is not long and the treatment itself is not traumatic. We have the skin pen in our office for the microneedling. It was the first FDA approved or FDA cleared microneedling device. So we have always used that since it was FDA cleared. And we have been extremely happy with it. So we take this little automated pen, and the pen has a tip, disposable tip, and in that tip, it's got these little tiny microneedles. And so they just make these little tiny punches in the skin, and your skin heals very easily after this treatment. That's why there's not much downtime. But in its healing process, it's producing new collagen. With new collagen, we get a glow, we get tightening of pores, and we get exfoliation as well. So, so it's a great, great treatment. It's very gentle. The PRP enhances the results. So there was some of the initial studies from PRP, if you look back at them, it actually shows that it produces collagen 6 times as much as if you do the microneedling by itself. So if you add the PRP to the collagen, you get 6 times the results of the microneedling. That's from a study of, that was the study that actually initially convinced me to add the PRP to these treatments. And that was proven by histology, by looking under the microscope and measuring the collagen growth there. And then finally, Fraxel, we've mentioned it before, so it kind of overlaps the second column to the third column, but it really, really stimulates collagen. And I usually say this is just a sort of like an estimate, but 3 to 6 microneedlings with PRP is equal to 1 Fraxel. So probably 6 microneedles without PRP equals 3 microneedlings. With PRP equals 1 Fraxel. That's kind of how I explain it to patients during consultation. And that's just, like I said, it's an estimate. Sometimes we get better results. Sometimes the results are not as dramatic. Here's an example of Fraxel. This patient had acne scarring. And then she also, of course, wanted a little skin rejuvenation. So this is simply after 1 treatment, which is pretty remarkable. Usually for scarring, I'm recommending 6 treatments of Fraxel. But you can see even after 1 treatment, she has some really nice improvement. So collagen, collagen, collagen is the bottom line here. So again, going back to those MMPs or those matrix metalloproteinases, we get the UV exposure, we get collagen fragmentation, less structural support leads to fine lines, saggy skin. We're gonna reverse that with collagen, and when we do that, we get more structural support and healthier looking skin. So again, that's sort of the concept behind why we're stimulating collagen to reverse sun damage. Okay. And then finally, in this slide, we're just also adding in Ultra Clear. That's our newest laser. We've had it for about a year. Ultra Clear is an ablative erbium treatment. So it's in the same category as a fractional CO2. This is fractional ablative, but this laser is a little bit of a newer technology than a lot of the fractional CO2 lasers. And so we do get decreased downtime with the Ultra Clear compared to others in the category. And we also get more comfort during treatment. It's not quite as sensitive as a traditional fractional CO2 laser. So that's why we have this in the office. And you'll see a lot of times people ask me, when should I do Fraxel? When should I do Ultra Clear? So we actually pulled this really nice investigative study done a few years ago. And this showed a few things, but it compared an ablative versus a non-ablative technology, not the exact same devices we have in our office, but the concept is the same, ablative versus non-ablative. In our office, it's ablative erbium versus non-ablative erbium. And for both lasers, they did see in the sun-damaged skin, they saw the disorganized collagen. Before treatment for both devices, they saw new collagen afterwards and new collagen organization. These are how these devices work so well. And so we get new collagen and remodeling of the elastin in the skin. And the elastin is what makes the skin bouncy and youthful looking versus as someone gets older, it just sags down and it's no longer bouncy. And that contributes to how we perceive skin as being youthful. So both the collagen and the elastin benefits are nice and more comprehensive than one versus another. So basically, they showed that it required three non-ablative treatments to equal one ablative. So 3 Fraxels are approximately going to equal 1 ultra clear. So you can see as we get a little bit more aggressive with the technology, with the newer technology, and the downtime becomes a little bit longer, we have to do less treatment. So that's why during the consult, I'll usually ask patients, are you a person who wants to come in a little bit more often but have less downtime? Or would you prefer to come in once a year but have more downtime when you come in? So we can guide you on these treatments during your consultation. Here is an example. This is an old before and after, but this is my patient after, I believe, 6 microneedlings. And you can see that we were treating acne scars and she had a really beautiful result. We didn't have our beautiful photo finder photos back then, so that's why you see a difference in the lighting. And then here is an ultra clear. You saw an example of the Fraxel patient earlier. Here's an ultra clear patient where you see improvement in the brown spots. But you also see, if you look at her lower face along her jawline, you also see pretty nice treatment, or I'm sorry, a pretty nice improvement of the jowl area. And that comes from the skin contracting and tightening from all the collagen being produced in one session. And if you look too, you just see, like if you look at her chin, the chin, it seems a little more compact. That's because the skin is just tightening here. And so rather than being loose and making this face look kind of bigger in the lower face, it's really tightening and making the lower face look more compact. And even if you look at her forehead too, you see those lines in the frown line area, see that's much tighter in this after, and that's just after one treatment. Okay, so those are the 3 pillars we're thinking about. And so what does this mean for you and where do you start, etc.? Well, remember, I usually start pillar 1, pillar 2, pillar 3 in that order. But you can think of it this way. If your skin feels dry and tight, if you feel like it looks dull, and if it's a little bit prone to rashiness or itchiness or just sensitivity in general, we need to start with repairing your barrier. So that can be with the good skincare products and or something like a Diamond Glow treatment. If you're seeing a bunch of uneven pigmentation, especially after the summer with the heat, the inflammation from lifestyle changes, and brown spots from summer sun, then maybe we should start with the pigmentation and evening out the skin tone, making it more uniform in color. That's very effective at making us look younger. So we talked about IPL, V-Beam, the Fraxel if you want both 2 and 3, or you can also do chemical peels, which are quite straightforward. And then finally, pillar 3, that is going to be addressing the collagen loss. So that's going to be starting at the deepest layer and improving the skin from the deepest layer. That also reverses sun damage. So I didn't touch on this as much this presentation, but when you do these treatments, you're also reducing your risk of basal cell skin cancer and squamous cell skin cancer. So you really are reversing some of the sun damage by doing these collagen stimulating treatments. So for these, we didn't talk about the first 3 there, but we're talking about microneedling with PRP. We're talking about Fraxel, and we're talking about Ultra Clear. So again, kind of a different schematic. We can include all of these into your treatment regimen, or you can just start with one or the other. You don't have to go in order. If you really, really want to focus on the collagen, then we should start with number 3. So we can mix and match, or we can do one versus another. And if you're not sure, this is where we come in. We are here to be your experts in how to make your skin better for you. So please come in, ask our advice, and we are more than happy to have a consultation with you and to help you decide which way you want to go. But the real bottom line in here, like I said earlier, the sun damage is cumulative, and these changes you may be noticing now are only going to progress unless you do something to stop it. And you don't have to do anything major, but you should start now, because the sooner you start, the more impactful it's going to be over time. And these things are so preventative that even if you're just doing these little things, even if you just change your skincare, even if you just do one IPL treatment, you're going to see the benefits of that over time. And we really do expect you to see the difference on your skin once you implement these changes. So please consider doing this for yourself. You'll really be glad that you did. You can never start too early, and no one ever comes in and says, geez, I wish I would have waited to do these things. Okay, remember, healthy skin comes first. It's part of your overall health, and this is a form of self-care. So you're really, really going to be glad you did this for yourself. And let's stop this this accumulation of damage and actually reverse it and go the other way. And we talked about consultations. Okay, let's talk about the promos. So for this first promo, we are focused on your barrier repair. This is from the first pillar. So we're going to do a peel on you. That's also going to help with texture, and it can help a little bit with brown spots. So there is actually a little bit of overlap between 1 and 2 with this package. So we're going to do a gentle peel with you, a micro peel. This will be with our estheticians. Then we're going to do the red light. So this is anti-inflammatory. It's going to help the barrier in that way, and it's also a little bit pro-collagen. And then we're going to provide you with a travel size Elastin hyaluronic acid immersed serum. So this is topical hyaluronic acid. It's going to help repair your barrier. It can be used alone or underneath your moisturizer. And so the price for this is $150. It's valued at $286. So you save $136. This is something that's very easy for you to do. You can do it. You can plan to do it before a party or an event, as long as we do a gentle micro peel. This package will be done with our estheticians. And the only thing is, with any of these treatments, we recommend that you not get direct sunlight on your skin for 7 days prior and 7 days after for a light-skinned individual. For darker skinned individuals, we want to extend that to 10 to 14 days. We can help guide you on this. Or if you've had a consult with us before, you know what to do. But basically, that's your restriction with these, with all of these treatments, including this package. Okay, package number 2. This is going to target brown spots, and so and texture. So now we have an overlap between pillar 2 and pillar 3. So you're going to get one IPL of your face and neck, and then you're going to get one full face microneedling with PRP. So you're going to get texture and you're going to get brown spots. And then we're going to give you at that time, you're not going to start this beforehand. We're going to give you, to start later after healing, an Epionce lytic treatment. This is one of my favorite exfoliators. You can use it in place of a retinoid, but it's actually not a retinol. It's salicylic acid based, so it's gentler than a retinol. It can help with exfoliation and brown spots. I love, love, love this stuff. It's one of my favorite products. And so, so we're going to give this all to you for $1,300. You save $220. You get to do this all in one day, which is really nice. Like, let's just knock it out, and you get pillar 2 and pillar 3 together. And then final package is for those of us who struggle with redness. flushing, rosacea, genetic redness, just irritation from the environment, we're going to give you 3 of the V-beam treatments. These will be spaced at least 1 month apart. And then we are going to give you, during that same day, we're going to give you micro needling and a PRP treatment. So again, we are going to stimulate your collagen using the micro needling. So you'll come in, we'll do the V-beam, and then we're going to do micro needling and PRP right after that. And this is going to be great. By the holidays, your skin is going to be glowing, and you're not going to look like Rudolph. And so your package price is $3,000. You're saving $750 on those 6 treatments done in 3 treatment sessions. Also, you're going to get Epion's Intensive Nourishing Cream. Like I said, this is my favorite moisturizer. I love using it. It improves the skin barrier. So this one's all about the barrier and the redness. So we do these for you guys so you can get started on your journey and you can get as good of a value as we can offer you. You will have until tomorrow, end of day. So our phones turn off at 4. You'll have till tomorrow, end of day, to purchase. So please consider these, and we'll send them out in the email too. But now we've saved some time for your questions. So if you have any specific questions, if you have generalized questions, I would love to help you with them. And I'm going to have my assistant, my lovely assistant, not Vanna White, but Emma, come in and pull up the questions. And I'm going to have another drink of coffee. Okay, amazing. I'm seeing the speaker, but no charts. Uh-oh.
Oh, I don't know.
Okay,
haven't seen it.
what is, hopefully you guys saw the presentation. I'm just saying now that some of you weren't able to see it. But hopefully you, Tom, you were able to jump on and see the presentation. You guys see it? Okay,
Mhm.
okay, so I'm getting feedback that we were, at least in the office, we were able to see it. Okay, what is the downtime recovery for V-beam? That actually is a great question, and I forgot to mention it, so I'm so glad you asked that question. This is a treatment that most people are able to go back to work or go back to their social schedule. There really is no downtime to the V-beam laser, with the exception that sometimes patients, especially patients with rosacea, have very sensitive skin, very reactive skin. So if you do tend to have reactive skin, meaning like a lot of times if you try a new product, your skin gets really irritated or puffy. If you can get a little puffy around allergy season, you might get swollen afterwards. So the first time you have it done, if you traditionally have very sensitive and reactive skin, I would just maybe not plan anything super important the next day, but you're not going to have any like peeling. The redness is not going to be dramatic. It just might be like a little bit more swollen than normal. Your face might be a little more swollen than normal. Sometimes you might feel like you're a little redder than normal, but again, it doesn't tend to be dramatic. And I would say 98% of my patients will just like leave the office and go back to work. So I do want to throw in that caveat. Every once in a while, I have a patient who gets a lot of swelling. So the next question is V-beam, Fraxel, or maybe Clear and Brilliant. So V-beam is a laser that's completely different than Fraxel. Fraxel is really focused on collagen stimulation, and it goes back to the science behind it. So with lasers, there are specific things that lasers target, and Fraxel, Ultra Clear, and Clear and Brilliant all target water. So the light goes into the skin and is absorbed by the water as that's a natural part of our skin. And that absorption results in heat, and the heat stimulates the collagen. So that's how you get these wonderful collagen results. Now with Fraxel and Clear and Brilliant, you also get some exfoliation because of that heat. And so the exfoliation can help with a lot of times brown spots. If the skin is super sun damaged, I do see redness improve with the Fraxel laser. This is kind of getting in the weeds a little bit, but a lot of times that's a great benefit of the Fraxel. The skin just looks less reddy, but that's because the sun damage is being reversed. The V-beam specifically is designed to treat redness. So that beam of light goes into the skin and is absorbed by the blood and the blood vessels. And so when it's absorbed by the blood, that produces heat, and the blood vessel either gets smaller, or even if it's an extra blood vessel, goes away. And that's why we see reduced redness with our eyes microscopically. It's getting rid of the little tiny blood vessels we don't need. Next question, can you recommend any at-home red light masks or panels to support our time in between office visits? I love that question, and I get asked that question all the time. So here's the problem with what we have currently is this major studies that we have available to date. And I assume that there are companies working on this, but to date, we don't have any great data about the proper dosing for red light, meaning there are like a million companies out there making red lights, masks, panels, and a lot of times they have different dosing, they have different numbers of lights, the intensity of the lights are different. And right now we don't have a great head-to-head comparing different brands. And a lot of the companies uh, have done small studies using their own product, and usually that will show improvement, especially if they're publicizing it. So, but that's not ideal because again, the study is going to be biased until we have a head-to-head study. But I do like to encourage the brands that have data behind them, even if they are biased. You can look at the before and afters. You can kind of glance over the studies and see if they're scientifically sound, see how many patients they tested. Usually the more patients, the better. And so those are some ways that you can choose an at-home device. I kind of just go with Omnilux recommendations. They do have some studies. Again, they're not the most scientifically sound studies, but they're decent, and they're so widely used by the community that I'm comfortable, fairly comfortable with their safety too. You should always be sure you're following the manufacturing directions. Like I said, each of these companies is a little bit different, so you should look at their directions and follow the directions specific for that device so that you don't cause any harm. Next question, any specials for Ultra Clear, and what is the downtime? Thank you for asking that question. No specials for this webinar with Ultra Clear. We have had several promos this year in the webinars. We've had maybe like 3 webinars featuring Ultra Clear. So this time around, we chose not to do an Ultra Clear promo. We have not had a microneedling promo for a long time, over a year. And so that's why we chose to do the microneedling promo. But tune into the webinars because you never know what packages we're going to be offering. The downtime for the Ultra Clear, if we're talking about your face, it's about 1 week. So it's the same as with Fraxel for the face, but the first 3 days is going to be more dramatic than the Fraxel. So you are going to look very, very puffy for 3 days. Sometimes you ooze a little bit of fluid, so some clear fluid or even some bloody fluid. And then it can be pretty sensitive to touch for the first 3 days. Not painful, so to speak, but a little bit more sensitive than Fraxel. But like I said, the trade-off is you're getting a lot of results in one treatment. I personally had the Ultra Clear done in March of this year. I had the Ultra Clear done when we were looking at bringing it into the office around the eyes, but I had a full face done in March. And as soon as I started producing collagen from that treatment, so 3 to 4 months later, so relatively recently, I have gotten more compliments in my skin than I ever had in my entire life. And I cannot wait to do another treatment. But even me, who I'm willing to do most anything and work through it, I'm kind of waiting for some downtime so I can get through those first few days and not have to see anybody. No promos for the Fraxel Dual for the same reason that I listed earlier. And how soon after package one are you able to do laser treatment like Halo? I love it. So I would probably wait, I would probably wait 2 to 4 weeks after doing package one. And my esthetician will, one of the 3 estheticians will help to guide you. I think if it kind of depends on your skin type and your peel that you choose to do, but I would say 2 to 4 weeks, and we'll tell you more when we do that chemical peel on you. Patty, which treatment is best to reduce fine lines and wrinkles? I would say package 3, Patty, because you're getting 3 microneedlings with PRP. And then the V-beam 2, I didn't really touch on this, but any laser that you have, especially repeated, is going to produce collagen. So for my patients who have done multiple V-beam treatments, the more treatments they do, the better their skin gets, even in the non-red ways. And so I really do see improvement in the collagen with the V-beam, even though its main superpower is treating red. So the package 3 is going to give you the most improvement for fine lines and wrinkles because it's got those 3 microneedling treatments, but the V-beam will help too. Okay, is it recommended we consult with you before we buy a package so you can guide on which one is appropriate? So what we've done with this, I've tried to make it as clear as possible in the presentation, like what's bothering you the most? Is it the skin barrier? Is it the brown or is it the red? But if you're still unsure, what we've done before is if you're established with us, you can communicate with my scheduler, Tracy, and she can communicate with me. I can look at your photo and then we can, I can kind of guide you that way. So if you're established in the office, I'm happy to look at your photo and recommend what I think would be the best for you. If you're not established, I would absolutely recommend a consultation if you feel like you need additional clarification after seeing the presentation. A little more on IPL versus Fraxel. Concern is freckles and darker spots. Thank you. I had freckles once, but freckles came back. I had Fraxel once, excuse me, but freckles came back. Okay, so if they're true freckles and you had them as a child, then they will come back and they will not go away completely with either IPL or Fraxel. If they are sunspots that you developed after, starting at age 30 and beyond, we can get rid of those with either Fraxel or IPL. It's just that Fraxel is going to do more for your skin, but it's also more expensive and has more downtime. So it's a little bit for your time. If you're just thinking about your time, it's definitely a better choice to do the Fraxel. But if you're mainly looking at brown spots and you're less concerned with collagen right now, you may want to do the IPL because there's less downtime usually, and it's not quite as expensive. Now, with sunspots, important point, any spot can come back and you will continue to get new ones because of that lag time we talked about in the presentation. So when you get sun exposure, there's a lag time before the consequences show up in terms of brown spots on your skin. So we expect you to get new ones. And if you have freckles, like true spots that you had as a child, those will not go away. However, we can lighten them with either device, but we expect them to come back. So that's why a lot of times with people who are really concerned with brown spots, I'd love to recommend one treatment every 6 months because then we're getting things as they come up and the downtime is very minimal or none. And we don't even have to wait for them to bother you. We just basically, in your eyes, we keep them away. And what we're doing is treating them when they're microscopic or very, very small to keep the skin clear and to also encourage the collagen to grow by doing a regular treatment. So hopefully that helps. And then any specials on Fraxel? No, not on this webinar because again, we have featured Fraxel several times during this this calendar year. So this time we wanted to do something a little bit better, or I mean, sorry, a little bit different to better represent the different treatments we have in the office. And then for the Fraxel, a treatment for Fraxel for full face is $1,550. So that's one treatment for face. And if you do the neck, it does add on cost. Face, neck, and chest is a different cost. It's $35.50 for the face, neck, and chest. Face and neck, I believe $23.50, approximately $23.50. That's ballpark. What does the ultra clear laser do? Okay, so if you wanted to do the least amount of treatments possible and you didn't mind some downtime, it is going to help exfoliate your skin. It's going to help get rid of some of the brown spots. It is going to help make collagen. And the last one is the most important one. It will make the most collagen treatment for treatment out of anything we've discussed. It's going to result in 1 week of downtime, 3 days of being extremely red, extremely puffy, and your skin might feel a little bit sore, not painful when you're sitting. It's not going to be super painful, but it's going to be a little sore to touch when you're putting your products on. After the 3 days, you turn a corner and we're talking about face treatment. You turn the corner and your skin is just looking red and a little puffy, but it's not really sore anymore for most people. And you have 4 more days of downtime. You can go out during this time. The first 3 days, you may not want to. I didn't want to, but starting at day 4, it's not really as big of a deal, but you will look like you've had a laser done. And you get a nice tightening of skin. I've noticed a lot in the lower face, the skin really tightens. It's great preventatively because you're slowing down the aging process. When you do tighten the skin will sag, excuse me, at a slower rate than when you have the loose collagen in the skin. You're also preventing non-melanoma skin cancers. So you'll prevent basal cell and squamous cell skin cancers. We can also target certain areas. When we do the ultra clear treatment, we treat the upper eyelids and the lower eyelids as well. So if you're willing to do it, we put a metal eye shield in. It's like a metal contact lens. I slip it underneath your eyelid and it protects your eyes. So I treat right over this area and right over this area. And sometimes we just do that area. We don't necessarily have to do the full face. Sometimes we just do the eyelids and sometimes we just do around the mouth, or we can do the full face first. And if someone wants a little more tightening around the eyelids, if everything looks great, but they want more here, we can just do the eyelids another time. And so you get a lot of tightening and your eyes will open up a little bit because you get tightening of the eyelid skin. The eyelid skin is really thin, and so it's easy for this treatment to tighten because of the heat that's resulted from the treatment. And also another area that it really helps are the fine lines around the mouth, especially if there's some really like kind of tissue paper skin there or crepey skin there, can really help to tighten in that area. So it really shines when it comes to skin tightening, tightening around the eyes, tightening around the mouth. It's a really great treatment. Like I said, I can't wait to get my next treatment done. What is the cost of the V-beam? I think I can get my husband in for this with you, with your explanation of downtime. Thank you so much. I really appreciate that. The cost is $500 per treatment for the face. And again, when you're doing a series of treatments, it's really straightforward. We do the treatments about 1 month apart, but if you're traveling, you know, it's no big deal to extend it a little bit longer. We usually just don't do it before the 4 weeks unless we're treating acne or acne scars. And then we just keep going till the patient is happy. Each treatment, you'll see a little bit of an improvement, but in general, I recommend at least committing to at least 3 treatments. And we don't we don't prepay or anything like that, except with, the package. But typically, if we're not doing the package, we don't prepay. We just take it treatment by treatment. But for most of my patients at treatment 3, after treatment 3, they're saying, wow, I'm so glad I did this. I see a noticeable difference. I'm not flushing quite as much. And then, like I mentioned earlier, the more treatments you do, the better. So usually between 3 and 6 treatments, we're kind of done with our initial initial series. And then every 6 months, I see the best results because you're continuing to improve, you're continuing to make collagen. But sometimes patients don't want to do maintenance. They'll just come back when it bothers them again. And if they do that, usually it's years before I see them back, but then they'll do another series of treatments. But I've had treatment patients who've done like 30, 40 treatments with me over the years, a long period of time, and their skin is amazing. And again, like I mentioned earlier, they went from someone who is really self-conscious about their redness and their skin quality, and they went to someone who now gets compliments all their time on their skin and very confident about it. So to see that transformation is really incredible. And then what is the cost of Ultra Clear? So the cost of Ultra Clear varies a little bit. And I'll tell you why. It's extremely customizable. And that was one of the appeals of this laser. So the cost starts at $800 a treatment. And that's for a very light treatment that our estheticians do. And for that treatment, actually, we're not looking at 1 week of downtime. We're looking at maybe like 2 to 3 days of downtime. So that you would do on a Friday, and by Monday, you feel like you're good to go already. Especially if you cover with a little bit of makeup, just kind of depending on your skin type and how fair or how pigmented your skin is. Um, so it starts there, and then it goes up both in downtime and in price, depending on how aggressive we want to be. I will say the average treatment we do is a treatment we call a moderate treatment, and that's 2,500. And so, and then it goes all the way up to 3,500 for the face. But the most common one is 2,500, and that's doing a really deep treatment around the eyes and the mouth, and then a lighter treatment over the top and everywhere else. And that will give you those results that I talked about earlier. But the Ultra Clear really kind of depends on what downtime you want, what your goals are. And that's what makes it such a great device, because when we do this treatment, when the treatment that the estheticians do, when we were first getting the device, the estheticians did the treatment on each other, and I had to observe them doing a certain number of treatments before they were able to do the device. And these patients we were doing these treatments on were saying, oh my gosh, I wouldn't even need numbing cream for this. This is very, not a big deal. I don't want to say comfortable, but very not a big deal for a laser. But then the higher we turn the settings, the hotter the laser gets. And so, for a treatment where we're doing a moderate treatment, we're numbing for 90 minutes in the office, but only topicals. Where in the past, when I've had a fractional CO2 laser, this was 15 years ago, I would spend a whole hour injecting numbing in patients so I can give them an adequate treatment. So to go from an hour of injectable numbing and dental blocks to 90 minutes of just topical numbing is a huge change in this technology. And with this device, I'm getting better results than I did with that device I was using 15 years ago, the fractional CO2. So I'm really excited about this device. I think it's a great one, and it's extremely versatile. So we'd love to see you in for a consult and talk to you more about it. But hopefully that helped a little bit with the cost. I am really happy to answer more questions if anybody has more questions. Otherwise, I guess I've gone over time. I just looked at the clock. So thank you for those of you still here for hanging in there with me. And I know it's a little long-winded today. And I stumbled over my words a few times because of this early wake up to take my son to football, but I really hope you consider taking advantage of these, and I hope to see you in the office soon. Thank you so much for joining us.